So the Health and Social Care Act fragmented public health and further hollowed out the public health capacity. And instead of rebuilding public health, the government has had a privatisation programme. So it's largely, instead of rebuilding all the testing capacity in NHS laboratories, it's largely privatised that and plans to spend £100 billion of our money on a largely privatised testing capacity. In addition to this, instead of rebuilding public health capacity in local authorities, which is where the best place is for testing and tracing in the community, the government has further fragmented it and privatised large parts of the test and trace system, giving £12 billion worth of contracts to companies like Serco, Deloitte and Amazon. And as we know, the test and trace system hasn't been working effectively. Fewer than 25% of people are managing to self-isolate. And what's really essential is the community response and ensuring that people who have to self-isolate have financial support, adequate housing, including hotels or other apartments if they need it. And that's why we need to see the test and trace strategy returned into health services and into local authorities, so health services locally, GPs and local authorities understand their populations, they understand the individuals and what services they require and the support they need to isolate, which is why the tens of billions of pounds that are being spent just now on test and trace and on the testing programme, Operation Moonshot, must be put back into rebuilding public health capacity locally and rebuilding the capacity of NHS laboratories. And this is why local campaigns such as the one in Oxford are so important and need to be supported. So this is why we need an active campaign for find, test and trace, and to return that into health services and to the local authority locally, and to stop the privatisation that is ongoing.